chat room. So hello everybody. As you might have guessed, I am not Emily Coles. I am Mike Lawson of the Diabetes Hands Foundation. And I'm really excited for the video chat today. We have with us Dr. Korey Hood, who's a licensed clinical and health psychologist, and he spent a lot of time working in the diabetes space. And in the recent past, he's been working in research, specifically with teens and type 1 diabetes, and he's going to tell us about that a little bit, I hope, today. And Korey was recently researching at UCSF for a while, and he just made a recent transition to a little-known place called Stanford. And he's written a few books, like the ADA's Teens with Diabetes Clinician Guide and Type 1 Teens, A Guide to Managing Life with Diabetes. And the work he does is really phenomenal, and I would credit that to the fact that he is also one of us. He lives with type 1 diabetes himself, and he's also a 2014 Boston Marathon finisher, so we might get some questions about that in as well. Dr. Korey Hood, go ahead and take it away and let us know who you are.
Okay, great. Well, thanks so much, Mike, for the introduction and then also for the opportunity to do this. And you know, I appreciate everyone who's already joined, and for those that will view later. So just a quick kind of intro, a little bit more about myself. As Mike mentioned, I have type 1. I am going on my 15th year now taking care of type 1, so I was diagnosed as a young adult. And I actually was diagnosed pretty soon after starting work in diabetes, so starting research in clinical care in diabetes. And so there was a stretch of a couple weeks where I thought I caught it from one of the kids, but after I learned that wasn't the case, I have been constantly doing this kind of work over the last 14, 15 years. So when Mike and Emily reached out to me to do this presentation, I first thought, you know, I'm not entirely sure what we want to talk about. So what I wanted to do was to kind of dive in and to talk about a couple of things, and then really to open it up and have an opportunity for discussion and comments. So I'm gonna share some slides now, and if there's any issue with that, let Mike know, and we'll try and fix any of those situations. Okay. So hopefully you can all see the title slide there, and what I do on kind of a daily basis around my work is I run various clinical research trials, and often what we're looking at is kind of the human or the psychological side of diabetes. So here at Stanford, we're doing a fair amount of work on the artificial pancreas and other diabetes devices and technologies. And then I also have a regular clinical practice where I do assessments or work in therapy, group settings and individual as well, really around the psychological side of diabetes. So those are absolutely fair game, fair questions for us to talk about today. A couple things I wanted to note at the beginning. What I'm going to present and what I talk about for the next few minutes is not intended to be an exhaustive review. And as you probably hear in all of these type of presentations, not providing any kind of medical evaluation or suggestions for treatment. The other thing that I think is important is in a short presentation and a discussion like this, I think it's hard to fully address considerations for different cultures in the LGBT community. I think that I'll hit on a couple of relevant points, but I don't think that I can do justice to different considerations in this area. But what I hope we can talk about today, and what I hope to achieve, is really provide an open forum to discuss diabetes, sex, and optimize the quality of life. So these were the topics that I thought may be of relevance to those viewing today. And this is from reading the research literature, working with young adults with diabetes, from hearing others in the diabetes online community talk about these different things, reading different discussion threads. So these are all ones that we make it on. I was going to talk about a couple of these before I opened it up. But certainly thinking about dating, intimacy, disclosing diabetes, I think all tie into sexuality. Also thinking about sexual performance, thinking about potential sexual dysfunction, treatment options for that. And then really embedded in all of this is this idea about the psychological side of diabetes, that no matter what you do medically or in collaboration with others, that if you're not paying attention to that side of diabetes, I think it's going to be a tricky ride. So I was going to just give us a little bit of an entry into a couple of these topics, and then I'll hopefully stop talking so much. But one of the areas that I think comes up a lot, and that I get asked a fair amount of questions about, is diabetes and dating. And the two questions I get asked most often are things like when to disclose and how to disclose that you have diabetes. And this comes from teens, young adults, it doesn't matter if it's type 1 or type 2. There are all kinds of different situations that pop up. Some kind of general suggestions I have in these areas that will also maybe come out in some of our questions. I'm a big fan of planning ahead, not necessarily having everything scripted with what you might do on a date, but to have a little bit of control over where it's going to happen, the timing, the different activities you're doing. If you're going on a hike, you're probably going to want to carry something that's a low supply for lows. If you're doing whatever it might be, you need to have some plan in place for what's going on. And I think you may get different responses depending on who you ask. I don't think that it makes a lot of sense for people to disclose that they have diabetes as the first kind of encounter that they have with that particular person. It's not the thing that defines you as a human, and so thinking about when you want to disclose it or when you want to talk about it, and that can be early on, or it can be in the next, the third or fourth date that you have with somebody. Thinking about when you are going to feel comfortable doing that is important. It needs to be disclosed, but it doesn't necessarily have to be the first thing. The third point here is thinking about sex with diabetes, not having sex with diabetes, but sex as a person with diabetes, in a similar way as other performances. I think we can sometimes get caught up in all the different pieces related to sex. But the reality is that there's much overlap with physical activity, there's much overlap with kind of a physiological arousal of the body, and that understanding how your body responds in different situations is going to help you in the situations that involve sex. And then, as I kind of noted before, I'm thinking about specific plans for checking, insulin pump, and the supplies. I think those are critical parts. So this is just a little bit of an overview about high-level ideas about what to think about diabetes and dating. And then we'll dive into some more details with some of the questions. So as I jump to the next slide, I wanted to just ask Mike if everything sounded good, if there's anything not going so well.
No, I think it's doing really well. The chat room is not really asking too many questions at this point. There's been a couple of questions that I'm hanging on to, and I will kind of maybe bring up when it's a little more close to what you're talking about. In fact, I think you'll probably address a couple of the questions in a slide or two.
Okay, that sounds great. So I wanted to hit on a couple of points related to the psychological side of diabetes. And you'll see how this has some relevance to what we're going to talk about kind of more broadly around sexuality or sexual performance. But it's very well documented that diabetes, whether we're talking about type 1 or type 2, has a major psychological side. And this side can sometimes be characterized by feeling distressed or depressed. It can be inclusive of things like social anxiety, nervousness about checking in public, telling others. And it also has a component of feeling disengaged. And I mean that word in the nicest way possible. Not that you're purposely checking out or that you don't want to do certain things. It's sometimes when taking care of diabetes and stuff, it's hard to stay engaged and stay on task. And so thinking about sexual function and performance can really be a major area of stress. And I think it's one that's often, it's rarely discussed and one that hasn't been given kind of full attention, partly because of the nature of it, but also just because it's something that many individuals just aren't real comfortable talking about. So I wanted to highlight just a couple of studies because I wanted you to know that for a couple of reasons. One, I look to the medical and scientific literatures when I want to understand what's going on, but I also think it's important to know that there are individuals and teams investigating these things. And many of these individuals have either a kind of a clinical stake or a personal stake in diabetes. So this was a study that was published a couple of years ago in the Journal of General Internal Medicine by Elizabeth Beverly, Marilyn Rickles, and colleagues at the Jaws and Diabetes Center in Boston. And while this wasn't specific to sexual activity or sexual performance, one of the things that they focused on were patients or the individuals with diabetes and their perceptions of blame and how much that interfered with their ability to take care of diabetes. And I pulled out one of the quotes, which you may have already read at this point, but I'll go through it quickly here. One of the individuals in the study responded in this way: when I see high numbers, I feel lousy. I feel frustrated with myself. I feel that it's my fault because I can't keep, because I keep looking at the pieces I can do, like the exercise and the food, and saying, well, you're not doing those things that you know. And one of the things that happens, I think, for many of us is when we fall into a cycle of self-blame, feeling guilty, and feeling responsible in many of these ways, it creates an environment where we may disengage from management, we may disengage from others, we may not feel comfortable talking about these different areas because we're a bit ashamed about them. So I think that this is an important area to be aware of, and in those cases where blame comes in, it's important to find ways to work past it, and we'll hit on a couple of those as we move along. I also wanted to highlight this study. This was published in Diabetes Care last year. And one of the things that they were interested in was understanding some of the personal and relationship challenges in adults with type 1. So the previous study I just mentioned talked about adults with type 2. And you can see the red bars here, the red boxes. And what they did was they had a number of focus groups and interviews with adults with type 1, and essentially they settled on 4 different areas that these individuals found really stressful. One was the impact of diabetes on their relationship with a significant other partner. The second area was understanding the impact of hypoglycemia. And then the third one was around the stress and potential complications. And the fourth, which is a little bit less relevant to our talk today, was about the benefits of technology. But when you think about these first three areas, there are a number of potential negative sides of taking care of diabetes and living with it on a daily basis. And this comes from both the individual with diabetes as well as the partner. But what was interesting was that in a number of cases that were described in this paper, that as you can see in the bottom box, sexual intimacy problems, that was something that plagued a number of individuals and had an impact on their relationships, and also some worries about potential complications. So I think that I wanted to highlight these two studies because I hope that those individuals listening can recognize that even if this isn't being talked about a great deal, there are a number of people endorsing that this is a problem or a concern for them, and that there are high-quality teams across the country thinking about this and trying to come up with some better ways to help individuals with diabetes. So this was one of the things that I examined in preparation for this call is just looking for this webinar, is thinking about some of the different and kind of varied ways that sexual dysfunction and diabetes kind of show up. And one of the things that I found disturbing is to think about the high rate of sexual dysfunction in men with diabetes. And many of the papers, and if you look at different areas, the individuals are going to talk about, over 50% of men with diabetes are going to experience some kind of sexual dysfunction. And most commonly, it's the second bullet around erectile dysfunction, or ED. And this is really defined as difficulty maintaining an erection. And no matter what, if you're looking at individuals with type 1 or type 2, you still see these high rates. But what's interesting is that the risk is actually higher for men with type 1 versus type 2, although both are at elevated risk compared to men without diabetes. So what you're seeing, if you compare the rates of sexual dysfunction in the general population, so these would be men without diabetes, the rate or the risk for men with type 1 diabetes is almost 3 times as high. And the risk for men with type 2 is about 1.5 times as high. So these are significant risks. And I'm not so sure that these are risks that are talked about early on in diagnosis. They're generally not grouped into kind of a larger category of complications that individuals are talked about with. And I think sometimes individuals have to find their way to this information, or unfortunately experience this before they even realize what's going on. The causes are varied, and I put this point in about not beating yourself up for a couple of reasons. The assumption that you did this to yourself is not an accurate assumption. I think that many discussions about complications may have an underlying theme to them, that somehow you didn't do a good enough job taking care of your diabetes, or somehow you caused this, which that's not an acceptable thing to have conveyed to you. But in this case, it's particularly inaccurate because the data are only slightly compelling when you think about glycemic control and blood sugar control, and that being related to some of the cases of erectile dysfunction. There are a number of different areas that come up that are associated with diabetes, and hormonal changes, and sometimes low testosterone rates. And for some of these reasons, treatment often is multimodal, so there are a lot of different ways that you can treat it. often the first line is through medication. And these medications are highly effective, and these are the class of drugs, the sildenafil and others that with brand names of Viagra and Cialis. And the rates of use of these and the effectiveness of them is actually very high. And I would encourage you to take a look at a couple of different resources when you're thinking about this, and hopefully we'll have some questions in this area or other things that we can chat about. But there are several links here. There's a nice article in the Diabetes Forecast from a couple of years ago. There's a nice article, I believe it's last year, in Diabetes Self-Management. You can check those out. There's a more scientific paper in current diabetes reports for this year, and it's a really nice paper that talks about some of the different causes as well as the different treatment options. So to sum up the slide portion of this, I wanted to highlight that I think most men face challenges navigating sex and diabetes. I think that many men are going to face challenges of sexual dysfunction. And so being aware of it, being prepared to talk about it, knowing who to talk to about it, and I also think it's important to monitor the psychological side and obtaining help, seeking these very effective treatments. And one of the important themes is that having open communication with partners and friends, while it might be tough, that these are important. This is an important part of kind of navigating this world of sex around diabetes. So I was going to just bring us back to this topic slide, and was hoping that we might have a few questions about some of these. I can dive in a little bit more detail to any of these ones that we wanted to talk about, and be happy to take any questions if we have any ready. Right?
Sure. Yeah, I think that the last bullet point on your previous slide about being open and talking with partners and friends about this, it kind of segues into a question that's been asked in the chat, and I kind of have a variation on it as well. What kind of tips could you give us on maybe starting that conversation with a partner? Maybe this can be a two-parter, like a conversation that happens before performance issues occur, and then maybe some tips on how to start a conversation after some performance issues are showing up.
Yeah, it's a good question. I think that I would encourage anyone who's thinking about engaging in sexual activity that your partner know about diabetes, know that you have diabetes. I think that going into any kind of intimate situation or sexual encounter and having that giant thing on your mind is going to just ruin whatever you think is going to happen. So, if you're on that first date or on the second date and things haven't progressed at that point, then maybe you don't talk about diabetes yet. But I think as you're entering the time when sexual activity is going to happen, I think that you have to mention it. And I think people can choose to talk about diabetes and disclose it in whatever way. I tend to sometimes use a little bit of humor. You can go just directly at it. In those kind of discussions, I wouldn't bring up potential sexual performance as one of the negatives or potential downfalls. So I think you want to go in feeling confident, feeling as if you can handle the situation. So I would talk about diabetes more generally, have a good plan when you're thinking about kind of potential issues with sexual performance leading into the situation. When they've happened or when they've occurred, it's I think that talking about it in that exact moment can sometimes be really hard. So I think that maybe finding a time after something has happened, when it's a little bit quieter, when there's not as much kind of emotion and arousal involved, I think you can talk about it a little bit later. And I suggest explaining it as, this is not necessarily something that happens all the time. I think it may be related to diabetes. Certainly you can blame it on, there's good data on very high blood sugars and having trouble with performance, and certainly very low blood sugars. So I think you can talk about it in either of those ways. I think that talking about sexual dysfunction is a kind of a whole entirely other discussion. I'll stop there and see what you think about that, and if there are any other kind of follow-ups.
You know what? No other follow-ups in the chat just yet, but I'm kind of thinking of my own question in my head. We've talked a lot about erectile dysfunction, but would advice ever be that maybe like a rock-hard erection is not the be-all, end-all? Like, is that ever advice that you give to kind of help people? I feel like we're giving a lot of weight to, an erection and erectile dysfunction, and we talked about drugs right away already. Where's your head?
Oh, I'm sorry, I missed that last part. What did you say?
Like, what are your opinions, basically?
Well, I don't think that the first place you go is thinking about medication. I think that I think you're right that there are several other places to start, and I agree with you that kind of this notion that the majority of sexual dysfunction is talking about ED, and that's probably not full characterization of what's out there. So I think that I'll give kind of the classic psychologist answer. It depends. But the reality is, I think it does very much depend on kind of the situation and the people involved. What isn't dependent on the situation is that you have open discussions about it. And what usually happens, I think, from a male perspective, is that there's a lot that's built up in terms of anticipation or potential failure or performance anxiety, and often an actual discussion with a partner can dispel some of those performance anxiety issues. And there's plenty of data to tell us that things like anxiety and stress can affect how aroused you can get and your overall sex drive. And so I think that those are things that you have to really get rid of early on, or areas around performance anxiety.
I think that's a great answer. Another question that we are getting, not everyone in the chat right now is, TuDiabetes is filled with people that are also living with people that have diabetes or married to people with diabetes. So maybe if we could talk a little bit about what kind of advice you might have for somebody who's in a relationship, who's partnered with a man who has diabetes and potentially ED. How can that conversation work?
Well, my experience with this in working with couples in these situations, and also just conversing with individuals with diabetes and their partners, the amount of actual support is often a high level, and that everybody is kind of engaged in this, wanting the support and wanting it to work out. What usually gets in the way, and not to kind of categorize or stereotype all men, but often it's the kind of egos and what we think of as the equivalence of being kind of manly and tough, and as with being able to perform sexually. And so I think that sometimes we spend a lot of time in our own heads about these things. So when you're thinking about partners, I think partners can get at some of these issues or talk about them in a couple ways. I would say first, never bring up this concern or question to the man with diabetes when some kind of sexual activity or intimacy is going on. That is at the peak of potential feelings of performance anxiety, worry about what's happening. So talk about it at a quiet, calm time, private time, the next day or the next morning or something like that. I think that saying, giving a few examples or commenting on some things that happen in a very supportive way and with not a lot of information, I think is a good way to start. Don't go on a 5 or 10 minute discussion of all the things that have happened, how stressed they might be. Bring up 1 or 2 things. Say, I really want to help you figure this out. I'm here for you. I'm supportive. And then go into the discussion. I think it's also important to have done a little bit of research about what potential options are for either changing kind of lifestyle behaviors at home or what are some medical options. I think having that in the back of your head is good. I wouldn't bring that up or make those suggestions. What I would say is, what do you think is what can we do about this? How can we work together to figure this out? And so that if the partner, the man, brings up a couple different options, you may already have some ideas about what we can do. But many of these situations, the thing that gets in the way the most is really ego, is wanting to please from the man's perspective, and I think that those are legitimate things, but taking those few strategies might be ways to kind of come at it in a very gentle way.
Cool. And then this kind of segues a little bit nicely into another question we have about partners. And the question really is if you have any suggestions on how to have a conversation with a partner who's kind of uncomfortable with the gadgets that we have, our pumps, our CGMs, etc., while we are negotiating moments of intimacy. Like, any suggestions on that conversation?
I have a couple thoughts on it that hopefully get at the question you're asking from a partner perspective, but a couple general things first. Diabetes management has evolved to a point where there are a lot of different devices, technologies, and tubes, and all kinds of things that none of them jump out at me as being sexy or provocative in any way. I think they're things that we, it's just part of what's going on. I think that generally when we have some of these kind of initial things that come up, I think that thinking for yourself about the way that you want to handle it is really the first critical piece. I just as a little anecdote, I have worked with a number of teams and in different groups and kind of educational sessions. And, there was, I think, one question about disconnecting the pump, and after some more questions, I think that there was a misbelief or incorrect information about how long they could be disconnected from the pump, as well as how long the sex was going to happen for a 14-year-old boy. I mean, it wasn't going to go on all night, and you weren't going to be disconnected all night. So I think that with these different gadgets, you have to go in to sexual encounters and activity with a plan. When are you going to disconnect? How long is it going to be okay to disconnect? And if it goes longer than you think it's going to go, it's probably going to be okay. You can also think about things like setting off, or turning off alerts and alarms, except for the absolutely critical ones. So I think that if there are ways to reduce the interference that you get from devices in sexual encounters or activity, I think it's planning ahead as much as you can, and then loosening up how tight blood sugar management needs to be in that time period. You certainly want to prevent the extremes, but the difference in kind of mid-range blood sugars and something in range is probably not going to be that dramatic. So, from a partner perspective, I think this is a tricky area. I think that the best thing that partners can do is to it's not just kind of a statement of embracing those different technologies, but it's actually trying to get involved and maybe to say things like, oh, you know what, go ahead and disconnect now. I think that'll be fine. Or do you want me to put that somewhere else? I think that actually having an active engagement in those things can help a lot. I think that the supportive statements certainly are good, but doing some task around that can actually be both supportive and make the guy feel like it's not something that's getting in the way. There may be other things I can think of, but do you think that gets at your question?
I think it actually answers it really well. Another question that pops up is, when is it time to seek medical advice for performance issues like ED? Like, one bad night, is that when I go in and I have this conversation with my doctor, or what would a good line be? And I'm not saying like, when do I seek medical advice? Because I know your answer will be, if you think you need a doctor, see a doctor. But like, when can I kind of figure out when I should have that convo?
Yeah, that's a good question. And I, those kind of questions, I think everybody's a little bit different in terms of kind of how long it takes them to notice that there's a problem. In general, guys wait a lot longer to notice that something's a problem when maybe others would have picked it up earlier. And I'm not calling all guys idiots by any stretch. I'm just saying that sometimes it takes us a little longer to arrive at knowing something's a problem. And so I would say that if you have an event that happens where there's performance issues, whether it's inability to get an erection, or that you can't maintain it for very long, or you find yourself not being very aroused, I think that those are things that they happen once or twice. I think it's good to document, to think about what was going on, if there are any specific situations why that happened. Once they get in the order of happening repeatedly 3 or 4 or 5 times, I think it's worth then talking to either your primary care doctor, your diabetes doc, whoever you're seeing. I think it's worth chatting to about it. I think that it's and maybe some ways to bring that up are this is something that I noticed the last time, and does this sound like anything that other people have? You can take that approach. You can also say, I think this is maybe what it is. What can we potentially do about it? In many situations, what typically happens is that in these situations, the medical professional takes the word of the individual. There's not usually an extensive evaluation that goes on, and they usually often kind of take it at their word. So I don't think it's a bad thing to do it early in the course, but just having it happen once or twice is probably not enough to die there. At least that's my opinion.
What about somebody who, this is a question that was asked, and I could kind of maybe expand it a little bit too. What if an insurance plan doesn't cover Viagra or Cialis? Or what if somebody is hesitant to get on another medication or wants to try some other things before medication? Is there anything that you might suggest?
Yeah, and I can go back to the paper, but I think once this lives on YouTube, you'll be able to go back and look at some of those slides. That paper in Current Diabetes Reports, and if you aren't able to get it, send me an email or contact me, and we'll get you this, or at least a summary of it. They talked about a lot of different options, and one of the things that there have been a couple of clinical trials on improving sexual performance and reducing dysfunction through certain kinds of diets. And so I think that individuals, there are great options to try first. I also think that many times working on de-stressing and performance anxiety can be areas that can help quite a bit. I think that if you try those things, whether it's lifestyle or relaxation, if you try those and you don't have much change over the course of weeks or months, I think it's probably worth it pursuing medication. Many of these medications get in and out of the system relatively quickly, have relatively few side effects, and so they are pretty safe as long as you're using them the way that they're prescribed. If someone doesn't have insurance coverage for them, I think that the cost of some of these generics has gone down significantly, so that's potentially an option. I would not encourage people to kind of buy distributors online. There are some questions about the reliability and what is in some of those products. So I certainly would discourage that. I think that maybe looking at some different diet options and some other alternative remedies may also show some benefit. What you generally see in that area is they don't have quite as robust effect on what you're hoping to change as some of the medicines, but they still would have an effect.
Cool. And then we have a question that I believe I know the answer to, but I'm going to get you to go on the record for it. Can you tell me, sex will lower blood glucose levels, true or false? Why?
Well, it's interesting. I think that in general, the answer to that is going to be yes.
Right.
Because of physical activity. And depending on the duration of it, if it's 5 minutes, you're probably not going to see a big impact. If it's 20 minutes, if it's an hour, if it's even longer, you're going to see an effect of that. And it's going to be a similar effect that you would see from exercising at that intensity. So that's one important thing to consider, is that it's likely to lower your blood sugar. So some individuals may plan out getting less insulin during that time if they're on it. Some individuals may have a snack. It sounds silly, but those kind of things will prevent both kind of physiologic performance issues as well as worries, nervousness about potentially well. The other thing that you probably will notice, many people do, is an initial kind of spike in blood sugar, and it's the artificial spike that many of us get when there's adrenaline, or we're aroused, or excited about things, and so you may actually see a little bit of an initial surge, and I think in many of those cases, most individuals, you try and kind of ignore those, and they kind of come back down, especially with physical activity. So this is a long-winded answer to say basically yes, but you might see kind of an initial surge.
Cool. It looks like we're having some audio issues a little bit on your end, so I'm going to kind of wrap it up a little bit. Just, I think we got to a lot of the questions. If you didn't get your questions answered and you still want to continue this conversation, there is a group on TuDiabetes called Diabetes and Sexuality for Men. There's also a group called Diabetes and Sexuality for Women. If you'd like to join either of those, we can continue the conversation there. Korey, thank you so much for joining us. I think it's been really informative, and it's been good information.
Thanks for having me.
All right, bye everybody.